So the beginning of our graded motor imagery training starts with phase one, and phase one is laterality training. It's recognizing the right side of your body versus the left side, or the left side versus the right side. And we do that through an app that is called Recognize Hand, Recognize Foot. They have all kinds of recognize. You can do recognize knee, recognize back, recognize shoulder, but right now I just have the recognize hand and foot downloaded on my iPad. And our patient here today has a right ankle injury. So what we are going to do is we're going to do recognize foot. The app then opens up and looks like this. We are going to say that we're going to play. And what we want to play is left-right discrimination, which is right up there. There are 3 phases and 3 levels of the recognized foot that we want to go through. The first phase, which is the easiest one, is vanilla feet. Then it goes to context and then to abstract. So each one of these is progressively harder. And that's all part of the graded approach. So right now, this patient is going to do the vanilla feet. So how we set that up is I will ask the patient, you would ask the patient, what is your pain today? 0 out of 10.
7.
All right, and you scroll it. We're going to click 7 and done. And then this is set. We will set that. We want 5-second flashes for each image. And when they are doing it at home, they need to have 50, they need to practice with 50 images, 6 to 8 times a day. But right now for this demonstration purpose, we're just going to do 20. So that's 20 images that are flashed up at 5 seconds. Now, what the patient is going to do then is when the image is flashed up, they are going to discriminate between a right foot and a left foot. And then they'll have to press whether it's the right side or the left side of the body when they do it. All right, so here we go. I'm going to let our patient go ahead and do this. Go ahead. You also have to instruct them to not try to move their body, their head, or the device that they're doing this on, their phone, their iPad. They have to purely look at it and determine whether or not it's a right extremity or a left extremity. Remember, the goal here is that they get 80% accuracy on the right side and the left side at this level consistently before they move on to the next level. And we'll see how she does. All right, well, let's look at that. She has a really good, she's a pretty good score on the left side, which is 80. And then on the right side, she has scored 70. And which is your involved side?
My right side.
So interesting. So what we would do is have her stay at this level and practice this level until she consistently got 80% or higher on each right and left side. So what we're going to do is we're going to go ahead back and we're going to play again here. But I'm going to show you what the context looks like. And again, this is all set up. She's at a level 7 out of 10. We're going to do 5-second flashes and then 20 images. All right, so this one is supposedly a little harder. Let's see how she does. Well, interesting. She scored reverse on the next level higher, but that's all right. We're just practicing here, so we'll keep going. Let's see how she scores on the highest one. That'll be interesting to see. All right. And what's nice about this is that you can actually document it. It will keep a record of all the patient's tries, their pain, and they can present that to you at a treatment session so you know if they've progressed or not. And I will objectively write down when I do my evaluation and have them do this at the initial evaluation, I write down their scores each time they come in to look for an improvement or a change. All right, so this is the hardest one. Let's see how you do on this. You'll probably rock this one, right? All right, go ahead. Well, we can see by this score that actually maybe that middle score was a fluke, an outlier. So I would again have her start at the vanilla level and work at that until she gets a consistent 80% and then work her way up to this hardest level. All right. So we are done with the left-right recognize part of graded motor imagery.